And with the Connecticut shooting still haunting most of us, the subject of mental illness is definitely something we all have on our minds. And as a society, we have to do more. I'd like to welcome Muffy Walker, who's the founder and president of the International Bipolar Foundation. She's here to bring awareness to this topic and talk about the misconceptions and resources available for all of us. Welcome, Muffy.
Thank you.
Glad to have you here. This is so important that you're here right now. There's been, a lot of shootings, massacres, needless, senseless massacres. So right now with a hot topic, it's a time to bring more public awareness and to get more help as a society, don't you think?
Absolutely, absolutely.
So where do we begin, Muffy? I mean, we need to talk about the history of this and what we're looking at now as far as mental illness, and what is our future? What can we do as a society? So break it down for us.
Well, I think I can share a little bit from a personal perspective. I have a son who has bipolar disorder. He was diagnosed when he was 4 years old. He's now 19. He's doing very well. And I'm a psychiatric nurse. My husband's a doctor. But when my son was diagnosed, we had nowhere to turn. There was no support system out there for us. We didn't know how to find a good doctor. And that's ultimately where our foundation was born, from needing to help other people grapple with this terrible illness.
And it is an illness that I don't know if it was lack of public awareness at the time, but it affects a lot of people. Can we talk about that?
Absolutely. Within San Diego alone, we have 750,000 people with mental illness. That's enough to fill Qualcomm Stadium 10 times.
Yeah, people don't
10
realize
times.
that.
In the United States, 1 out of 4 people will have a diagnosable mental illness at some point in their life. 1 out of 4. So if you figure you're sitting around the dinner table, you've got at least one person in the room who will have a mental illness.
And that's at least one person in your family.
Absolutely. 26.4%. 26.4%. And an interesting statistic is that of all the mental illnesses, that is 3 times all the diabetics in the country and 10 times all the people with cancer combined. Take all the cancers, 10 times that. That's a big number.
It is a big number.
That's a big number.
Now, in regard to your personal experience, your son is blessed by having 2 loving, caring parents to care for him and make sure he got good treatment and help and support. There are a lot of people who don't have that. And that's why we as a society need to be there and help these people and make sure they get the treatment and get the support they need, don't you think?
Absolutely, Taylor. That's a really big piece to the puzzle. The stigma is one of the hugest obstacles for people to seek treatment. They won't often seek treatment because of the stigma.
Stigma, and am I wrong to say that sometimes when people do, whether it's bipolar or some other mental illness, when you have the mental illness, you really don't know you have it?
No, I think people who have a mental illness know they have it, and perhaps not in the beginning stages of it. We see a lot of young college students who are starting to have the symptoms of a mental illness, whether it's schizophrenia or an anxiety disorder or bipolar. They don't quite understand where these symptoms are coming from. Maybe they attribute it to just college and the stress of college. They start trying
Partying, not sleeping.
Exactly. They start trying to quell the symptoms with drugs and alcohol, which of course makes the mental illness only worse.
Right.
And then they have some kind of full-blown episode of whatever the illness is, and then the diagnosis comes to fruition.
Oh my goodness. And so correct me if I'm wrong, but from what I understand, it can be in your DNA, right? It could be maybe dormant, and it can be triggered by doing drugs. I'm not sure about this. This is
No,
just
that's
some
true.
of the research.
Bipolar disorder, which used to be called manic depressive illness, is a biochemical brain disorder. It's an illness of another organ in the body, just like diabetes is, or sickle cell anemia, or Tay-Sachs disease, just another organ in the body. It is a heritable disease. It is passed along. It could, it's sitting there, as you said, dormant, until something triggers it, a stressor. It could be an environmental stressor. It could be a divorce. It could be abuse. I believe, and don't quote me on this, but I believe Jane Pauley's bipolar disorder came out when she went through surgery, and that was the stressor in her life. Drugs and alcohol can bring it on. all kinds of triggers can bring it on.
So what do we look for? As you know, I'm a mother of 4 daughters. That makes me number 5. So we're saying if 1 in 4, that could be very well one person in my family is going to have that. What would I look for? What would other mothers and fathers look for as signs, the onset, the first stages of it?
Well, just to clarify, it's not 1 in 4 people will have bipolar disorder. It's 1 in 4
Mental
people will have a
illness.
mental illness.
Okay.
And of course, a mental illness, if you look at the statistical manual, includes things like ADHD, anxiety disorder, social phobias, obsessive compulsive eating disorders, depression, etc. So
and
it's a whole
gamut.
A whole gamut
so
of
we're
illnesses.
lucky it's only 1 in 4 because that's a big list.
That is a big
But
list.
we
It
do
is a
want to
big
know the
list.
symptoms that we look out for, and then we want to know what we can do to help. But first, we got to take a break. We're back with Muffy Walker, who's the founder and president of the International Bipolar Foundation. She's here to bring awareness to this topic. Welcome back, Muffy. Okay, before we took a break, we talked about bipolar, the issue of bipolar. And there's a lot of mental illnesses. We also talked about how 1 in 4 people will have some sort of mental illness, and that's a huge gamut of issues. But let's break it down to just bipolar disorder. What are the early symptoms that we would look for so at least we would know how to help that person if somebody needed help?
Okay. As I mentioned earlier, bipolar disorder used to be called manic depression. So you're looking at 2 different poles. You've got the mania or the hypers, and I'll come back to that, and then you've got the depressions or the lows. So in the mania, anything that, I call them the hypers. So hypersexuality, hyper gambling, not just somebody who gambles, but somebody who goes well beyond their means, who has absolutely no money and is going to Vegas or gambling online all the time. Risk-taking behaviors, drag racing, speeding, jumping out of airplanes. Now, some of us do that, so there's a fine line there.
I'm like, uh-oh.
There's a fine line there. Not being able to sleep, grandiosity, where you believe that you are more than or think you are someone other than who you are. You may have delusions, which is a form of psychosis when you believe something that's not true. Maybe you believe that you're Jesus Christ. They're all of the hypers. Then the depressive things are, of course, the opposite. Perhaps you sleep all the time. You have no interest in life. You have no energy. Maybe you have thoughts of suicide. Maybe you have a plan for suicide.
And you will experience both of those polars?
So the person with bipolar has both, and they can cycle very slowly over a period of months between the highs and the lows, or they can cycle quickly. And some people are called ultra rapid cyclers, where they're cycling so quickly between the two, you're not really sure which phase they're in, or they have a mixed phase, if you will.
It sounds exhausting. For the person who has it, it's very sad. What do they do for people with bipolar? Is it a pill, or how do they help them?
Well, bipolar disorder is a biochemical brain disorder, so we need to correct this biochemistry that's gone awry. And I believe that the first line of defense is medication. Unfortunately, we haven't really had a gold standard come along since lithium. There are a lot of medications out there. Some of them are off-label, which means they haven't exactly been approved for the illness or for that age group, but they can be effective.
So with lithium and somebody's on bipolar, has bipolar disorder, does it help them lead a normal life?
Absolutely. We have people that run, just like any other illness, there are people that run the gamut from no symptoms to very, very, very ill. And you can take a look at Catherine Zeta-Jones, who has bipolar disorder. And then you can take a look at somebody who, Winston Churchill or Ernest Hemingway. Ernest Hemingway killed himself.
And they're usually
from his
a lot
bipolar.
of brilliant people.
A lot of brilliant people. A lot of creative people. A lot of creative people.
So you can have different degrees of bipolar disorder. So you can have very minor degrees, right? And then very major, like you just said. So what would be like Catherine Zeta-Jones? That's a minor.
In my opinion.
So what would be her manic day like? What does that look like?
Maybe she doesn't have a manic day. I shouldn't speak about Catherine Zeta, but for somebody who has a mild form of it, perhaps they just have a lot more creativity, and maybe they have hypomania, where they're just really feeling energized and getting a lot done. which I would like to have that that energy.
Right.
And then there's somebody who's very psychotic and believes only that suicide is the only way out, which really brings us to the resources and where can these people turn when
And
they
it's
have
usually the people that have the severe disorder that we need to intercept, maybe, because if they could be harmful to themselves and to others, then what do we do as a society? What are our resources?
Well, unfortunately, we've been pushing them under the rug. And there's been, as you mentioned at the beginning of the piece, about the terrible Connecticut shootings and how this young man, nobody knows really what was going on with him, and his mother alluded to the fact that he had some mental illness, but was he treated? And nobody knows, unfortunately. And there are so many people that don't go for treatment because of the stigma. The stigma is a huge obstacle for people to go get treatment. They're treated poorly by other people.
Judged.
They're judged. They're discriminated against. With regard to the belief that the mentally ill are violent,
Yeah, they're high risk.
the statistic actually shows
I'm
that
not saying that, but the stigma is
Right,
that they're high risk.
absolutely, absolutely. And but the stigma says that they're violent. The reality is that those with a mental illness are actually 2 times more the victims of violent crimes than the perpetrators.
I didn't know that.
2.5 times more the victims of a violent crime.
I had no idea.
Absolutely.
But
So this organization, International Bipolar Foundation, was founded because 4 moms, myself and 3 others, Karen Sheffras, Lisa Weinreb, and Lynn Muto, we were all educated women, and we had the resources, we had computers, we knew how to get the doctors. We thought, what about the other people who don't have these resources? We're having a hard time. What about them?
Right.
So we formed this organization. All of our services and programs are free. We have this book that came out last year, Healthy Living with Bipolar Disorder. It has a plethora of country-specific chapters. It's translated into a variety of different languages. We have a Girl Scout mental health patch that we're trying to teach the young girls what is mental health. Not necessarily what is mental illness, but what is mental health. Is going in the girls' room and cutting, is that cool? No, that's not cool. But that has become a trend.
Yourself,
Starving
cool?
yourself? Exactly.
No.
Not cool. And we're trying to teach them.
binging on any source? No.
Absolutely. So we do a high school essay contest around the world where
I
we have
love it.
people write about stigma in the year 2020. What will it be? We've had Glenn Close come speak to our groups. We had Patrick Kennedy in May. So we're just trying to bring more and more awareness. We have an outreach and referral service. Anyone who is in need of a psychiatrist, a therapist, a school advocate, they can contact us and we'll find that reference for them.
And what if there's somebody in their life, a friend or family member, and they think that somebody should be tested for it? Is there resources available for that, just to see if you're even dealing with that, any of the mental illnesses?
Right now, the tests are still in the laboratory phase, I would say. The way that the psychiatrists and psychologists diagnose is a decision tree. Do you have hallucinations? No, you go here. Do you have thoughts of suicide? Yes, you go here. How many days?
So it's bizarre to me that there's no real for sure test that they can say absolutely you have this, and your chemistry in your brain needs a little bit more here, and this is scientific data, right?
Well, there
It's
are some
guessing.
diagnostic companies who are working on the blood tests, genome studies that are working to see what medications will work on that specific illness.
Yeah, I love. But in the meantime, where could our viewers go right now, and the people who will be watching our show? Where can they go to seek help? Would we find this on your website, all the resources?
They can go to www.internationalbipolarfoundation.org.
Can we pull that up, please?
And they can send us an email if they have a specific question or a specific area of the country or the world where they live and they're looking for a resource. There's a resource page on the website. We do free webinars. We do free lectures that we videotape and upload to the website. All our services are free.
I love it, Muffy. Thank you for
Taylor.
making a difference in our society and on not only just a national level, international level, because we need more people like you who care and who provide resources and help and support. And thank you.
Thank you.
Thank you so much. And thank you for sharing on Primetime. Have a blessed new year. All right, thank you. We have to take a quick break.